Chapter 14, Problems of Adolescence. Adolescence is a time of great change and growth for individuals. Physical and sexual growth usually are completed by 16 to 18 years of age. In Western societies, the adolescent period is prolonged to allow for further psychosocial development before the young person assumes adult responsibilities. Generally, the adolescent period begins at ages 11 to 12 years and ends between 18 to 21 years of age. Adolescents undergo great changes in their physical, intellectual, emotional, social, and spiritual areas of their lives. With physical development, boys develop and mature more slowly than girls. Routinely in females, age 12 starts the menarche for a female, and the male growth spurt can begin around the age of 11 and will continue up till potentially the age of 18 years or even a few years after. Cognitive development or intellectual changes involve learning to use abstract thinking. By the ages of 14 to 17 years, abstract thinking is developed in individuals. Emotional development during adolescence is marked by periods of change as well as adjustment. Around the ages of 10 to 13 years of age, the emotional stability of childhood is replaced by a preoccupation with body changes as well as acceptance by peers. Social development is a very vital area for adolescents. The younger teenagers will struggle to establish a group identity as well as their own personal identity. Many teenagers will feel the need to belong to a group. During this age, they have many needs that are fulfilled by their peers. The most important function of the peer group is to help the adolescents define the differences between themselves as an individual and their parents. The spiritual growth for an adolescent begins when they question the family values and beliefs. Adolescents need to gain an understanding and control of themselves, and they need to learn to cope with living in a very uncertain world. Many of the common problems will fall into two categories. Those of internal sources, which are problems that arise within oneself, and external sources, which are those that are outside of the teenager's area of control. An important development problem of the adolescents is defining their self or oneself and establishing an identity that is separate from the family's identity. Adolescents will consider who they are and how they see themselves, how they think others view them, and how their relationships with various individuals affect them. Problems of adolescence will fall into three basic areas. It will be family, social, and environmental. A growing concern with adolescence is sleep deprivation. Teenagers routinely require 8 to 10 hours of restful sleep each night to function appropriately during the day. The individual has an increased need for independence. By that, the adolescents will change the family to adapt. Many teenagers are seeking freedom, but they still need guidance, emotional support, nurturing, as well as limits. Parents should encourage the adolescent to make decisions. This will increase the adolescent's maturation and their decision-making process. Separating from the family and establishing their independence are problems that are faced by every teenager. Difficulties that arise from within the family, that are not related to the adolescent's developmental stage. Families can range from being overprotective, where parents limit their children's experiences and not allowing them to make decisions, to those where the children will grow up on the streets with little or no sense of belonging to a family. Peer groups help adolescents by various manners, and they function by various manners. Number one, the function of a peer group will help to decrease the family ties. It will provide stability during times of change. The peer group will assist adolescents to define their present and their future social roles. It will also test their views of themselves. It will assist the adolescent to learn to trust their own choices, as well as learn to make and stand by their commitments. The last functioning of the peer group is to establish both behavioral and dress codes or standards. Not all adolescents are fortunate enough to have a caring, supportive family, and they are at risk because the conditions to where they are currently exposed may threaten their further development into adulthood. Nurses need to recognize the environmental conditions and problems that accompany the teenager if we are to provide teenagers with tools for a successful transition to adulthood. Things like problems of short attention span, increased distractibility, and high need for stimulation will make it more difficult for the adolescent to accommodate to the traditional demands for consistency of effort, concentration, and compliance that the family and school will make upon them. The word dysfunction meaning is impairment in everyday life. There are various adolescent mental health disorders. There are behavioral disorders like conduct disorder or ADHD. There are emotional disorders, which are anxiety or mood disorders. Eating disorders will be anorexia nervosa or bulimia. Another disorder is chemical dependency, can be abuse of alcohol, amphetamines, caffeine, various drugs like cocaine, marijuana, nicotine, can be hallucinogens, inhalants, opiates, or prescription drugs. There are personality disorders, such as antisocial disorders, borderline personality disorder, dependent disorder, obsessive compulsive disorder, and paranoid personality disorder. Schizophrenia can be classified as paranoid type, disorganized type, or delusional type. Sexual disorders can be gender identity disorder or inappropriate sexual behavior. Various other disorders of the adolescent can include adjustment disorder, impulse control disorder, or problems related to abuse or neglect. Disruptive behavioral disorder usually has two basic diagnoses: ADHD and conduct disorders. Attention deficit hyperactivity disorder, or ADHD, is usually diagnosed earlier in childhood, but the effect will last through the adolescent period and into adulthood. The key features of ADHD are inattention and impulsivity. Teenagers that experience ADHD problems, they have issues in focusing their attention, behavioral self-control, as well as relating to others. Because of these various difficulties, many teens will become chronically unhappy. This is when they may begin to abuse chemicals, or they could develop conduct disorders. A conduct disorder is characterized by a defiance of authority and aggressive behaviors toward others. Teens with conduct disorders will violate the rights of other individuals or defy the norms and standards of society. One common factor in the development of conduct disorder appears to be harsh parental discipline with physical punishment. Early harsh discipline will tend to foster aggressive behaviors later in the adolescent's life. Depression that is seen in adolescence is often characterized by irritable moods and acting out behaviors. In contrast to the classic depressed mood and loss of interest that is seen in adults. Symptoms of teenage depression will include decreased social activity, a decrease in school performance, feelings of hopelessness, a difficulty in thinking, the inability to concentrate, diminished decision-making, and various physical complaints such as loss of energy, headache, nausea, stomach pain, as well as altered sleep patterns. Related to eating disorders, there are long-term and even life-threatening complications that can result unless the medical and mental health interventions are undertaken. Because eating disorder patterns of obese teens do not impose an immediate threat, chronic overeating is not considered a mental health disorder. Many overweight teenagers, though, use food to help themselves through troubled times. And these teenagers still require mental health interventions to help them find more effective ways of meeting and satisfying their needs. Anorexia nervosa is a prolonged refusal to eat in order to keep body weight at a minimum, and it is characterized by an intense fear of becoming fat and a relentless pursuit of thinness. Anorexia is often seen from around age 12 years, and it can peak around age 13 to 14 years, and again at 17 to 18 years. Bulimia is a cycle of binge eating followed by purging. Bulimia often may not occur until later in adolescence, around 17 years of age. Both disorders also occur in adults, but the incidence decreases sharply after the mid-30s. It has been estimated that as many as 20% of college-age women are bulimic. Individual problems associated with eating disorders may include the inability to tolerate activity, a disturbed thought process, distorted body image, a low self-esteem that is prolonged, impaired coping, as well as denial. This slide points out some of the differences between bulimia and anorexia. If you notice, due to the thinness of the individual, anorexia causes situations like confusion, dry hair. They will have very fine, soft hair on their skin. They will have a low blood pressure. Their blood pressure will change with positioning, so they may have orthostatic hypotension. Muscle wasting may be seen. They may have decreased white blood cell count, decreased glucose levels. They may have blue fingertips, a decrease or a loss of their menstrual cycle, diminished reflexes, and they may have edema in lower extremities or cold extremities. In bulimia, edema may be seen. The individual may have diarrhea. They may have a decrease in potassium levels, but an increase in carbon dioxide levels. There may be calluses on the skin. The individual may have a normal weight, may be underweight or overweight. They will have erosion oftentimes and an inflamed esophagus in the that is due to vomiting and bringing up acid from the stomach. Teenagers that are seen as high risk for becoming chemically dependent are those that were abused as children, that come from families who either approve, use, or promote the use of chemicals, or have other mental health issues. With experimentation, pleasant moods and social belonging associated with drugs are experienced. Drugs are used for the first time within the comfort of a peer or a social group. Actively seeking. This teen will look forward to and actively seeks out the mood changes brought about by the chemicals. They will become an expert in using chemicals to regulate their mood. Schoolwork and relationships with family will erode. Their friends will become limited to other teens that will use chemicals. In preoccupation, the teen will believe that they cannot cope without chemicals. They have lost control over the use of drugs. They will develop a tolerance and they may begin to use other substances. The chemical is now used to prevent withdrawal symptoms. Psychosocial functioning will begin to fail. Friends are lost and may be replaced with antisocial, illegal, or violent behaviors. In burnout, the focus of the chemical use is now to prevent negative feelings. If the teen attempts to stop using this chemical, withdrawal symptoms will appear. Those individuals that progress to this level of addiction are usually not able to function productively in society. Many are late adolescents or young adults. A personality disorder is an enduring pattern of an inner experience and behavior that deviates from expectations of the individual's culture. This disorder will be universal and inflexible. There will be an onset in adolescence or early adulthood that will become stable over time. This will lead to distress or impairment. Long-term individual therapy in combination with selective medications provides a positive outlook for teenagers with personality disorders. Individuals with sexual disorders, they often have gender identity disorder, and they have a continual discomfort with their assigned gender. There is often a strong and persistent need to identify with the other gender. Sexual acting out is common for teenagers, and if the behavior results in discomfort or harm to themselves or others, society will define these behaviors as inappropriate. Neurotic behaviors are recognized as unacceptable, recurring, and persistent. Behaviors may be odd or unusual, but they're usually within the socially acceptable limits. The individual is in contact with reality and able to carry out the activities of daily living. Psychotic behaviors are characterized by personality disintegration, a reduced awareness, and possibly an inability to function within socially acceptable limits. This individual is not in contact with reality and is unable to carry out the activities of daily living. Psychosis is the loss of contact with reality. This individual may have hallucinations, delusions, and feelings of paranoia. These individuals will lack judgment, behave impulsively, and they will have little insight. the behaviors that they exhibit may become inappropriate, ritualistic, or repetitive. The care for all of these individuals with psychosis is focused on providing basic physical needs, which include feeding, bathing, and exercise, as well as providing a safe environment and assisting the individual to develop skills for successful living in society. The highest group at risk for suicide are white adolescent males who have expressed their intention to die. Previous attempts, written plans, and available tools for committing suicide all heighten the risk for future attempts at suicide. The increases in suicidal attempts are often seen after a classmate or a schoolmate has committed suicide. Teenagers that are overweight, gay, or bisexual are at a greater risk for suicide, as well as those who are bullied are also considered at a high risk of suicide. There are various warning signs of suicide: a loss of interest, changing emotional states. They want to defy the rules. They may discuss suicide with their their peers or close friends. They may give away prized possessions. They may have changes in their personal hygiene status. They may give hints about their intentions of suicide. For example, "after I'm gone" is something that might be heard. Surveillance is the actual process of watching over individuals to determine whether they are safe, following the rules, making good decisions, or whether or not they need adult intervention. The goal of setting limits is to encourage the individual's responsibility. Interventions are provided to help build self-esteem. As nurses, we help our individuals gain self-esteem. Ways that we can do this is to use eye contact, but we must think about the individual's culture. We will address each individual by their name. We will actively listen, convey respect. We will ask, and we do not order them to do something. We will also help the teenager to assume responsibility for the behavior as well as the consequences of the behavior. Praise with each effort when a behavior is changed and pointing out progress and successes will help to build self-esteem. We need to assist in problem-solving techniques and help the individual apply it to their own behaviors and their problems. Limits need to be enforced respectfully, and the focus needs to be on behaviors that should be changed. The overall goal when building self-esteem is to encourage responsibility for one's own actions and self-development. Working cooperatively within a group, learning how to listen to other people, and exploring new methods for controlling anger or aggression are therapeutic techniques that are designed to help the individual develop effective living skills and coping with society.